Hello, my name is Josh Anderson, and this is my skills demonstration for a patient assessment and obtaining a weight using a sling scale. To begin, I would enter the patient's room. I would introduce myself, verify the patient's name and birthday, and explain that we are going to be completing their assessment. Wash my hands and ensure that either the patient curtains are drawn or the door is closed. Begin by looking over my patient, ensuring that they appear to be at appropriate height and weight for their age. I would ask my patient if they are in any pain. If they were in any pain, I would ask them to rate the pain on a scale of 0 being no pain at all to 10 being the worst pain that can be imagined. Begin with assessing my patient's eyes. Using a pen light, I would check that their pupils are both equal and reactive. Would then ask my patient to lift their hands up and wiggle their fingers for me. I would then have them with their palms down, place my hands under their palms, lift them up, have them push my hands down, and then place them on the back side of their palms and have them pull my hands up. Then ask them if they could wiggle their toes for me. I would place my hands under their feet, instructing them to push my hands down like they're pushing on a gas, and then place my hands on top of their feet, instructing them to pull their toes up to their nose. I would check my patient's abdominal sounds. Checking each quadrant to make sure that it is active. I would assist my patient in sitting up, so I was able to check their lung sounds. At this point, I would check my patient's vital signs. Please see my other videos on how to assess a patient's vital signs. If my patient were able to ambulate, at this point I would assist them in getting up to go for a walk. That way I would be able to assess how their gait is and if it is appropriate. Now I would, if I had to use a sling scale to get my patient's weight, for using the sling scale, I am substituting a towel. Have my patient take and roll to one side of the bed. So I'd be able to tuck the sling under the patient's back, have them roll towards me, finish pulling the sling out before having them lay back on their back. I would bring the sling scale over and make sure that the sling scale is zeroed. I would hook the sling scale up to the sling under the patient and lift the patient up, ensuring that they are completely off the bed, and record the weight of the sling scale. Slowly lower the patient back down. Then I would have them roll to one side to remove the sling, tuck it under their back, then have them roll back towards me to finish removing the sling and finish laying in their back. I would ask my patient if they needed anything, ensure they had the call light within reach, and that would conclude my patient assessment.